Hello everyone, I am Dr. Shilpi Bhadani. I am a plastic surgeon at SB Aesthetics, Gurugram, India. In this video, I will be talking about upper facial rejuvenation. Now, we have already talked about brow lift where botulinum toxin can be used and it can give the outer corner of the brows a lifted look. The center of the forehead can be blocked and the outer corner consequently it gets lifted. But the problem with non-invasive procedures, even the thread lifts, it's very popular nowadays, but the problem with non-invasive procedures is that they are short lasting and that you have to keep repeating if you want a rejuvenated look, if you want to enjoy the rejuvenated look for a long time. The gold standard procedure for upper facial rejuvenation are the brow lift and the blepharoplasty, the upper lid lift. So, we can also combine these procedures and many times we do that. When the patient comes to us, they will come to us mainly with upper eyelid sagging, but we analyze the case and then we see that many a times it's the brows which are drooping and that is giving the upper lid a saggy look. So, in combination it can be a very powerful tool to uplift or to rejuvenate your upper half of the face. The brows tails can be lifted on both the sides, and the beauty of the procedure is that the scars are all hidden. That means we approach the brow from the hairline and we go under the skin, we tighten the inner tissues and then we can take off a little bit of extra skin and can stitch it. The recovery is really quick. It can be done under local anesthesia or under IV sedation with local anesthesia. There's literally very less downtime with this procedure. Even with an upper eyelid lift, if it's combined, then the downtime can be just 3 or 4 days and you can be back to normal. The stitches can be taken off in about a week's time, and even in the upper eyelid, the procedure can be done under local anesthesia and the scar line is very fine, hardly discernible in a couple of weeks. So, it's a quick in and out procedure, gives a very profound rejuvenated appearance to the upper half of the face. What can be combined with these two procedures is the forehead lift. That means the center of the forehead can also be lifted. Again, the scar is in the hairline or just behind the hairline, we can have the scar. And another procedure that can be combined with these is the fat grafting. With aging, what we see is that the temples become hollow. Many times we are using fillers to fill the temples, but when you are opting for a brow lift or an upper eyelid lift, definitely some fat can be injected in the upper half. Even under the skin of the forehead we can inject so that it gives a tighter look, and on the temples it can be injected. Again, these do not require any cuts, they are done via syringes, done via needles. Very small needle hole punctures can be made, and of course there are no scars or no stigma of the fat grafting procedure. Even fat grafting as a tool alone can be used to rejuvenate the upper half of the face, but of course it differs from case to case. So, all in all, the upper eyelid lift and the brow lift together or combined together, they are very useful to give the upper face a rejuvenated appearance. You can be free from the repeated cycles of injections and the threads, the other non-invasive procedures that you keep doing. So, it's a one-time investment of your time and money, and it can give you a rejuvenated appearance for years together. So, when you are opting for a brow lift through other non-invasive methods, do think that whether you are doing this repeatedly and whether it is really time to opt for a surgical options so that you can be benefited with these procedures. Thank you.